Hello. I just wanted to thank everybody for giving me the opportunity to come and talk today, and I hope you'll find it a valuable contribution to the discussions. Just from what I've seen since I arrived at lunchtime, there's loads to talk about. I wish I'd been here this morning. I'm just going to basically read to you what I wrote to Anna when I saw her request for people's stories, because I'm not too bad at standing up in front of people and talking at work, but don't normally talk about such personal and emotional issues. So I just want to start by saying that I know that both me and my little girl, who's 13 months now, being safe and healthy should be enough. And I really am grateful that we are. But I didn't end up with the birth that I wanted, and it still upsets me now. So I guess I'll talk a bit about what happened with me, and yeah, hopefully it'll help start some discussions. I had an absolutely textbook pregnancy. I saw the midwife at my GP surgery every few weeks, had scans at 12 and 20 weeks, and I loved being pregnant. It was great. From the midwives that I saw and at the Bump Birth and Beyond classes, I felt really supported in my desire to go to my local birth centre, gas and air, in a pool. I did my antenatal yoga. I had my hypnobirthing CD. So far, so good. The problems arose for me when I became overdue. Baby did not agree with the date I was given. I didn't want to be induced. I read up as much as possible, NICE guidelines, Cochrane Review, powers of the internet. And I was really concerned that an induction would lead me to further interventions and a really medicalised birth, which is not what I wanted at all. I even considered home birth for a while. So I went to my midwife's appointment just as I'd gone overdue. She said, right, let's get you booked in for induction at 10 days over. I was like, She said, okay, that's fine. Go and have a chat with a consultant at the hospital. This was, I'd rank one of the most awful experiences. I'd not seen a doctor my whole pregnancy. I went to the hospital, I sat in a room, I sat down, heavily pregnant. Two people who may or may not have introduced themselves to me, I don't really remember, stood over me and basically said, if we could, we'd induce every baby on their due date. Right, oh, okay, right. And I'm putting my baby at massive risk by not being induced. Okay, well, NICE guidelines say I can have additional monitoring. You know, I know the placenta doesn't work forever, but no. You should be induced. I did try and stand my ground, not a walkover normally, but it's really hard. You're made to feel like it's not your decision. You're made to feel like you don't know enough to make that decision. I said, why should I be induced? There's nothing to indicate that there's anything wrong. She's a few days over by your dates. She was even fewer days over by my dates. I said, I'll happily go on a monitor. If there's any signs of distress, be induced right there and then. But I kind of wanted a reason to be induced other than a date on the calendar. And the discussion was all about the risks of not being induced. It wasn't a balanced, there are risks of being induced as well. I gave in. I said, all right, I'll be induced, but I'll be induced at 42 weeks, on the Friday when I turned 42 weeks. I remember standing in the kitchen in the morning before I went to hospital, before I was induced, swearing to my husband, if they want to put me on a hormone drip, I'm going home. I'm going home. I'll have a gel. If it works, great. If it doesn't, I'm going home. I really didn't want to be induced. On the ward, the gel worked, by the way. First gel worked, lots of walking around. 2 lavender baths, some paracetamol that I threw up. I got to the point I'm asking for gas and air. I'm like, right guys, this is happening. Can I have some gas and air now, please? No, can't go up to delivery suite, no midwives available. Really? Okay, right. After midnight, so I'm now 42 plus 1. Yeah, you can go up to delivery now. Oh, if you'd have been before 42 weeks, you could have gone to the birth centre. Right, and you're telling me that knowing that my birth plan says I wanted to go to the birth centre. You're telling me this at 1 o'clock in the morning. What's the difference between now and an hour ago when I was 42 weeks to now I'm 42 plus 1? I don't think they thought about the impact of what they were saying. Go up to delivery. Midwife was good in some ways. Dim lights, aromatherapy. But in others, I don't think she even got my birth plan. We never talked about it. Don't think she'd have read it because I asked for intermittent monitoring and a return to intermittent monitoring after any continuous monitoring, if it was possible. And baby ended up with a clip on her head because I kept moving around. So the monitor didn't get a good signal because I was moving around, inconvenience. So we've got to get a trace, put a clip on baby's head. I asked my husband, did the midwife say that there was anything in the trace that was worrying, that she was concerned about anything? Nothing was mentioned to him. But I'm in the middle of contraction after contraction. I'm trying to get the hang of this gas and air thing. I don't have the capacity to ask her to say, is there a problem with the trace? Are you really worried? Is that why you want to put a clip on the baby's head? So I'm like, midwife says, can I put a clip on baby's head? Yeah, fine. Just give me the gas and air. Had a really quick delivery. Water's broken at 1 o'clock. She arrived at 3. Placenta did not want to follow. Wasn't ready. So I go down, have my epidural, go into theatre. I'd had a baby with gas and air, and then I have an epidural afterwards. Catheter, have to stay in overnight. All the things on the do not want list. It wasn't even mentioned that having a retained placenta was a risk of being induced. But I got a lot of, oh, that's a shame afterwards when you said why you were staying in overnight and why. From everybody, doctors, nurses, pharmacy people. You've got to go and get your injections for your DVT risk, which wouldn't have happened if I hadn't have had to have an epidural because of the retained placenta, because of being induced. So that whole list of interventions that I didn't want from being induced, I think I got them all nearly, apart from a C-section. Well, close. I feel really strongly, as you can tell, I'm stood here talking to you about it a year after I had my baby, about the way it went down. And I think the start of it was that conversation with the consultant, but it was also a lot of the little conversations along the way. I don't know how to change that. I know that what I wanted from a birth isn't what my best friend wanted from a birth. Give me all the drugs, just get it over and done with. So if somebody had have given her the birth that I wanted, she'd be saying the same things about it not going the way she wanted and not being happy. But yeah, that's what happened to us. And yeah, thank you for listening.
I guess the whole of that is the entire choice and personalisation agenda, isn't it? Wrapped up in your story, Jen, about how one thing is not right for everybody. We can't prescribe maternity care. It's so individual and so crucial that you, again, coming back to continuity of carer, that you actually really have time to listen to the choices and wishes of the family. And listen, like you said, that communicating with your husband at the time, as Graham said earlier, would have been a way to have that round of family conversation. Definitely something that can be picked up in the choice and personalisation workshop later on. But is there anything anybody wants to comment or say after that, other than that, or ask a question? Renika?
I just want to say one thing. I'm so sorry that happened to you in our system.
Absolutely. Talib.
Thanks for your story. That was really moving. I guess with a couple of your story and the other colleague at the back who spoke is, when that happens, how do we help people move on so that it doesn't become, say, an anchor that drags you down for the next 20 years? I don't know what the answer is. I think it's, there's lots of work going on about things like adverse childhood experiences, but you've both had different kind of adverse experiences, and we can learn from them and grow stronger and hopefully avoid it happening again. Obviously, we can't turn the clock back for you, but what sort of support could we be providing that would help you move on or deal with it? I mean, you might say, well, I'm fine, I'm here talking today, but that's also a worry that could go unnoticed, unacknowledged, but pop up in 10 years' time or 15 years' time and then be something maybe more serious.
Yeah, so when I was visited by a midwife just after I was born, I told her to calm down. I said to her, how did it go? Yeah, brilliant, she's here, it's amazing. You're not in the right place to think things through. It's only months and weeks and months down the line where you're playing it over and over again in your head. And actually on Monday, where Emma is chatting with Emma, going through my notes, having a sort of review, and I heard from friends in other parts of the country that they had that service, but it's only when I met Francesca and Anna that I heard that was an option here. It's not been bad enough for me to go to the GP and say, look, it's been on my mind, what can I do? But if I'd known about it through, leaflets and bits of information that the health visitor gives you, that sort of thing, I might have dug it out and followed it up sooner. So making people aware that that's an option is something.
Okay.
My name's Jen, I'm a midwife at Morecambe Bay, and I just want to kind of say some of the work we've done around about this. Mel Gard's already touched on it earlier. We do a communication matters study day, so all our staff have been put through that. We do 2 days a month where all our staff go through. We listen to patient experiences and how we can influence the way we communicate with our women and our families in our care. We've developed a discharge video that everybody watches to get consistent information. That's gone through Maternity Voices partnerships as well. And on that video, we've actually got a link and a phone number for our PMA and our Listen with Mother service, which anybody can access. Community midwives can refer women in. And I think from my point of view, I work on the postnatal ward. Anybody that I've got a slight inkling about that I think maybe they didn't quite get what they wanted, I send an email to Sarah and she'll follow them up. 6 weeks later, we bring women back to debrief with consultants, and I think that's really good work that Morecambe Bay are doing actually, and I think we're ahead of the curve with that compared to a few places. 6 weeks later, no, I don't ask the women, I just say, Sarah, I've got an inkling about this woman, I think this was our birth plan, this is where it went a bit different and a bit awry. Maybe it's worth a follow-up in a few weeks. And we get in touch that way a few weeks later, not 3 days later when you're home with your baby on cloud 9. That's not the right time. But days and weeks and months later, we pick that up and say, how are you feeling about that?
And it ripples from the MVP. It ripples through all the baby weighing. Sorry. I said the ripples go out through all the baby weighing clinics and from the mums who've had, we call it Listen with Mother at Morecambe Bay, but we do get self-referrals from people, from health visitors, GPs, consultants. I think it is one of the things, yeah. And we would also, everybody keeps the number, and then next time when you get pregnant, we will put in a specific plan. We can't always change. It might be that the placenta gets stuck again, but you will know that you've been listened to, and we will do what we can together. Yeah, no, it just make a huge difference, yeah.
Hi Jen, I'm sorry that happened for you. I've previously been working in service user forums, and it's a conversation I've had many times with service users about that conversation that first conversation you have about induction and with a midwife. quite often. And I know a lot of women have said they feel like it's an assumed conversation, that they assume that women are just going to say, yeah, of course I'll have an induction, and they don't. Yeah. So this isn't actually a question for Jen, really. It's a question for midwifery in the room, in that, are we going to be looking at that in any detail on how those conversations happen, those initial conversations about induction, that it's not just you're 10 days, I'll book you in for an induction at 10 days. Are we actually going to start having conversations about these are your options, this is what induction involves?
Okay. Kathy, then Amanda.
So in answer to your question, that's the topic of our next MVP meeting, induction of labour. So that's exactly what we're picking up.
Just with the point of induction, a lot of that's going to come from the Affirm trial and the recent studies that have come out about induction at 39 weeks for everybody, regardless. You know, there's going to be a lot for trusts to do around that, I think, in the induction.
Hi, I'm Mandy from the Maternity and Neonatal Collaborative. So there are two things thank you for sharing, but I think there are two things that we have to offer that might help. One is that as part of all of the service improvement projects, we want parents to get involved in those, and all of the trusts are active and willing and trying to recruit people to be part of the teams. But we can also provide, because we've got public and patient engagement leads, we can provide training to help people understand quality improvement and how people outside of the system can get involved. So I'm just putting that out there. If the MVPs want to take us up on it, we can do that.
Fantastic. One last one at the back coming. That's fine.
Thank you for sharing your story. I've been involved with the MVP in Morecambe Bay, and sharing our stories is a really powerful way of making change. I would say to all the other trusts in the area to look at the communication project led by Mel, to look at the changes being made. And you just reminded me actually that with my first pregnancy, I went along to see a consultant at 40 weeks, and he just went, right, so we're going to book you in for an induction. I was like, no, you're not. That's not happening. And I've heard that from other people, and I'm so sorry that happened to you. And it would be nice to talk afterwards, if that's all right.
Brilliant. Thank you very much indeed. Thank you, Jen.